Isabel. We are all prepped and ready for your abdominal assessment. So we are going to go ahead and get started. I'm going to start by just putting on a pair of gloves. We do have a couple different things that I want to look at this evening. Now, I know you stated you were having some symptoms in your abdominal region, mostly in your navel, umbilicus, or belly button area. So that is something that I'm going to be having a bit of an in-depth look at today. So I will be going over everything with you as we get started. I do need to have a pretty close-up look here to see what's going on. Based on some of the information you sent over, I kind of have a little bit of an idea. We might be looking at some dermatitis, but I do just want to make sure. So I'm going to go ahead and visualize the area, have a really good look with a couple different lights, and then I have some tools that we will be getting into a little bit later, okay? Okay, so you just relax for me, get comfortable. You're welcome to rest, sleep, whatever is better for you. If I have any questions, I will let you know. So I'm just going to start by exposing the abdominal cavity here. So I'm just going to bring my protective layer up. Covered from the top half, I am going to go ahead and lower your shorts so that I can have a look at the affected area. So I'm just going to pull them down slightly and then tuck the very front portion underneath. And that is perfect there. That gives me really great visualization of the area. So I'm going to go ahead and begin with your examination, okay? So I think what I want to do is have a look and just kind of get an initial idea of what I think may be going on. So I'm just going to start by having kind of an overall look at the skin in the surrounding area. So of course I will be looking up close there, but I do also just want to kind of look around and see if I notice anything abnormal here. So just starting by having a look at the surrounding skin, and do see a little bit of pinkish color here. It appears there may be some irritation of the skin along the kind of lateral left side, so something to note there. And just shining my light in different areas to kind of get a look at the overall texture. So closely looking at the very surface level here, noting any possible abnormalities. So far what I'm seeing is the surface of the skin is fairly smooth. Now, of course, everyone has a very slight amount of texture, as we can see here, and that is just elevation of the follicle, so that is normal. And also looking at hair pattern, noting symmetry in your follicles, and looking for any possible areas of concern here as well. So sometimes we can get ingrown hairs or very kind of microscopic folliculitis, so just having a look at these areas, and so far I'm not seeing anything abnormal, so that is great news. Okay. So just using my fingers to very slightly dimple this pinkish area. It does feel slightly raised in texture, so we might need to have a little bit of a closer look there. looking in sections really allows me to ensure that I'm not missing anything. Okay. So I would say that externally, everything looks fairly okay. I'm going to go ahead and have a look with my magnifying glass. So this is just another lighted tool that's going to allow me to have a little bit of a closer look at your skin, okay? So let's go ahead and go in with this and coming just a little bit closer to you so that I can have a better look here. So excuse me while I sort of invade your personal space. Just want to be sure that we are having a fairly thorough look here. So this magnifying glass allows me to have a better look at different blemishes of the skin versus of the naked eye. Excuse the ambulance. Of course, this is a hospital and we have several emergency cases coming in. I hope it's not too distracting for you. Okay, so I'm noticing a couple of moles here, but those do appear normal in texture and color. So I'm going to look at this very small blemish that I'm noticing here. And that appears okay. Okay. Again, noticing normal hair pattern. None of that appears abnormal. So having a look at your piercing here, just doing a surface level check for any notable scar tissue, which I'm not seeing. So that is very good. Okay. So upon initial inspection, just at the very base entrance of the navel, I do see some swelling. And it does look like we're looking at a possible case of contact dermatitis. Okay. Alright. Okay. We can go ahead and move on. And before we begin with any of our more invasive procedures, I do just want to take a couple base measurements, okay? So I'm going to go in with my fabric tape here. Now, of course, this is just a ruler. It's kind of like a paper tape texture. It is a little bit cold, so I do apologize. It will be cold to the touch. Just going to be taking a couple base measurements so we kind of get an idea of the circumference that we're working with. Now, of course, these numbers will be documented thoroughly so that upon your next visit, we can kind of compare and see if any of that more notable swelling has decreased there, okay? So again, just coming in closer, and I'm just going to be using this to measure, starting with the diameter. So, of course, measuring the very bottom of the navel. And we're looking at about a 1-inch diameter. Okay. So I'm going to also do that horizontally or laterally. And again, we are at about a 1 inch, maybe 1 1/8 here actually. So you're seeing a little bit more swelling on the sides versus top and bottom. So just something to note there. So I'm just going to measure this little kind of pocket of swelling that I'm noticing on this side. So that would be your right bottom quadrant. It does appear slightly swollen to me. So what I'm going to do actually is use my calipers to measure more precisely. So this is just a metal tool, very, very cold to the touch. I do just want to warn you. Now this tool is going to allow me to pinch a certain area and then we can subsequently measure that area more precisely here. So I'm just going to start again by measuring the overall course, that is 1 inch. Okay. So measuring width. Okay. And now I'm going to measure just this little pocket of swelling that I see here. Okay. So I estimate that's at about 3/4 of an inch there. Okay. So there's some very slight swelling on this side. Okay. Alright, so in line with our measurements, I am going to go ahead and measure the very depth of your navel. So I'm going to be measuring the umbilicus, and in order to do that, I'm just going to use this tool. Now this is just a sterilized metal tool that is going to allow me to insert, and once I reach the base of the umbilicus, I will then mark the top, and then we can measure the distance here. And the purpose of this test is simply to measure for swelling. So we have about a normal indicating range for an adult female your age. Now we'll take measurements this time, and then of course upon your subsequent visit we will redo those measurements and compare them. Okay. Alrighty, so just going in with this tool here, I'm going to be flattening the navel just slightly, and we're just going to go in like this. I will pinch off at the end there, and now we have a distance from which we can obtain a measurement. So we are right at about 1 1/8 inches. And I'm just going to do that one more time to ensure that there is no error. Okay. Yes. Right at about 1 1/8 inches. Okay. So we will go ahead and document that and then add it to your file, and then we can reassess next time and see if there have been any changes there, okay? Going to go ahead and proceed with the secondary portion of our examination. Now, in order to do that, I need to perform a couple of tests first, and we will repeat a few of these tests afterwards and see if the findings change at all, okay? So the initial portion of our examination is going to be skin intact, just as is. I'm going to perform a series of tests, starting with palpations and percussions. So what I'm going to do first is just begin with some very gentle palpations, and that's going to consist of some light movements of my hands, okay? So I'm just going to be using my hands, mainly my fingertips, to kind of palpate around the area, feeling for any possible abnormalities or concerns in the abdominal cavity, specifically around the navel, but I will be checking everywhere just to ensure that we're thorough. So I'm going to start on this side. So this would be your lower left quadrant. And I'm starting with some very gentle palpations here, okay? So we are just moving inwards towards the navel. Working in a linear pattern allows me to ensure that I'm not missing any possible areas of concern. So once I complete a grid, I will move on. So moving in towards the navel, feeling for any possible lumps underneath the skin or deeper. So initially just doing a very gentle palpation. Good. And now I'm going to be moving downwards, still moving in somewhat of a linear motion. Gently palpating. And for any possible abnormalities here, at times you will feel me kind of slightly rotate my hand. Okay, so now palpating specifically around the umbilicus. You are doing very well. Thank you for your cooperation. I understand it can be slightly uncomfortable to have someone in your personal space, but I do appreciate you allowing me to conduct my examination to the best of my ability. So thank you very much. I'm going to go in with the secondary palpation, and this time it is going to be slightly deeper. So I'm applying a firm but gentle pressure. Small circular motions. To feel around the navel. Okay, so we can go ahead and move on to a few percussions. I'm just going to percuss very gently with my Reflex Hammer, so you're going to feel a very light tapping. You'll almost barely feel it, but this is an important part of the examination. I'm listening for any audible differences. So any areas that sound abnormal to me could indicate a possible abnormality lying beneath the skin, either in your intestines or in your abdominal organs. It also allows me to test for the integrity of the surface of your skin. All of that does sound very normal. Okay. So let's go ahead and move on. And I'm going to go ahead and test some responsiveness. Okay? So what I want you to do is just completely relax for me. Kind of try to calm your sensory indication if you can. So I'm going to touch the surface of the skin with a very cold object. And I'm looking for a very specific reaction in your abdominal reflex. So ideally when I touch you with the stimuli, your abdominal cavity should react in a certain way, indicating that the neurological function is intact. So I am going to just touch you with this object. You don't need to say anything. I'm just looking for your natural reflex to indicate appropriately, okay? I'm going to start here. Very good. So immediately getting reactivity there, as well as here. So that reaction does appear to be intact. So we can go ahead and move on to our second tool. And I'm going to go in with something slightly more distinct. So still a cold metal object. It's different though in that it does have these very sharp spikes. Now I don't want to alarm you. I'm not going to be penetrating the skin in any way. This isn't going to scratch you. It may produce a very slight sensation of discomfort, but it is a very important part of your examination, okay? So what I'm going to do is just very, very gently glide this tool across your skin. And again, just looking for that same reaction there, okay? So just relax for me. Just going to start here. Very good. So your abdominal reflex is very well intact. I can tell immediately that there is no lack of sensory response here. So that is a very good sign that this is not something neurological or something that could be more serious. It does appear that we are looking at possible fungal infection and not something that could be related to your nervous system, which is good news, okay? Alright, so all of that is great, and we are going to go ahead and begin with the third phase of your examination today. And what I'm going to do is begin by cleaning the area, okay? So I am going to go in with a couple different things. The first thing I would like to do is just clean kind of the surface of the skin. So I have a gauze sponge here. This is just the sterile sponge that I will be using to clean and dry the area. So I'm going to go ahead and open it. Now to clean, I am just going to take one ply here. Okay, very good. Now I have a sterile solution that I will be activating. So I'm going to start with 5 cc's of sodium chloride. Okay, so I'm going to go ahead and measure that out. Perfect. And I'm going to follow that up this product here, and this is just HIPAA cleanse, so this is going to be sterilizing soap, so very mild, but it does have sterilizing properties. So just measuring that out. And we're going to do about half, so we are at 7.5 milliliters. Go ahead and mix that together. What I'm going to do is just apply this topically. So I will be applying it to the area around the umbilicus, and it is cold, so I do apologize. Unfortunately, it is cold. You won't be uncomfortable at all, okay? Just starting by applying this to the affected area here, kind of creating bring down any possible infection rate. Just ensure that our solution is well mixed and that we are getting the adequate incorporation of both chemicals here. Now, I'm going to go ahead and dry the area. And I'm simply dabbing off the excess water. So the sodium chloride solution that I applied essentially is sterilized salt water, along with the hip cleanse, creates a nice foam. And that's a good indication that the area has been properly sanitized. So I'm just going to dry any of the excess liquid, and the rest of it will air dry as we proceed with your examination. I'm just going to place that aside and we can proceed. And what we're going to do now is move on to the interior of the navel, okay? So I'm going to begin by having a look, and I'd like to go in with my tweezers. So just using my Penlight as well as my tweezers to have a little bit of a closer look here. So I want to have a little bit of a better look at your piercing. So I'm using my light to look directly at the area. Healed tissue. It does not appear as if there is any kind of abnormal growth. Sometimes older piercings can have an excess of scar tissue, but I'm not noting any of that here. I'm just going to use my light to shine at the base of the piercing. Okay. I'm just having a look, of course, inside the navel. And as suspected, it does appear that you have a mild case of contact dermatitis. So I know you said you started having these symptoms after going inside of a jacuzzi. Okay, so you were at a hotel. So this is fairly common. It is something I see in several of my patients. It's not always the navel. I do see this kind of contact dermatitis sometimes appear on the hands, around the fingers. I also tend to see it on the feet. Can appear in other crevices of the body, but I have seen a few other patients get this sort of bacterial infection, fungal infection in their navel. Now, of course, I'm not sure whether or not this is a bacterial infection or a fungal infection. We will need to perform a swab and send that off to the lab. But it does look fairly standard. I wouldn't say that it's anything that is too concerning. So let's go ahead and clean the area, get it nice and disinfected for you, debride a little bit of that sediment, and then I will take a sample and we will get that sent off to the lab and we can get you on your way, okay? Okay. So actually to start, I am going to begin by taking the sample. And by taking the sample prior to us cleaning the area, it ensures that we are not washing away any of the possible bacteria that could be lying inside. So I'm going to go in with just a simple specimen set here. So I have a pretty standard cotton tipped applicator. Now I'm going to be using two, to ensure that the lab has an adequate sample. Of course, placing that in my specimen cup. Okay. So beginning with our first sample. Just going to insert and rotate. Insert, rotate. Perfect. Okay. Okay. So let's just break these off. And we will get this sent off to the lab. These samples usually come back within 24 hours, so I should be getting back to you with definitive results tomorrow. That's okay. I'm a little hungry too. Look at me. Okay, so we're gonna go ahead and put this in our bag, and I will get that sent off to the lab for you, okay? Move on. We're going to go ahead and do a cleaning of the area, and I'm going to mix up a little bit more of that solution. Again, this time not quite as much. I'm going to do about 3 mLs of sodium chloride. About 1 ml of the chlorhexidine. Okay. Alright, so we are going to mix that up and then get started. And again, this is going to be cold, so I do apologize. Okay, so starting with the initial application, and I'm just going to insert with my swab. Now this might be slightly uncomfortable. It is going to be slightly invasive. We aren't used to people poking around in our navel, so I understand if this is uncomfortable for you. I will try to make it quick and efficient, okay? Okay, so just ensuring that we clean the base of that piercing pretty well. Okay, just making sure that we really relieve any so this is going to help break up any dead skin. If it is dermatitis as suspected, there will be some flaking, so some dryness, might be slightly itchy, so you just want to make sure to dislodge any of that dry skin. I am seeing some of that skin now. It's not quite as severe as expected. It's really not that bad. Okay. Alright, so now that we have the initial application, I'm going to go in with a secondary tool, and this is just going to allow me to further clean some of the smaller crevices of the umbilicus. So I have just a little cotton tipped brush, and I'm just going to go in and further clean the area. So again, making sure that we thoroughly cleanse some of these smaller crevices. Okay. So I do see a little bit of that pinkish coloration here. Again, it's not severe at all. Depending on your lab results, I do think we can have this treated in less than a week, so that is really good news. Okay, so now that I think we have you cleaned internally, I'm going to go in with this tool here. And this just has a little bit of a silicone tip at the end, and it's going to allow me to scrape away any of that excess dead skin cells or discharge or whatever may be inside. So I'm just going to use this to scrape the walls of the umbilicus. Just very gently applying pressure internally. Okay. Alright, so let's go ahead and suction out some of that water. And this is essentially just going to act as a manual vacuum. Now that we got off the majority of the excess fluid, I am going to just go in with our sponge here. And again, this is just going to allow me to cleanse the area. So I'm just going to apply a very small amount of that solution. Once again, just ensuring that we are removing any possible contaminants. If we can clean the surface of the skin of any fungus or possible bacteria. You will be on your path to feeling back to normal. Just using this exfoliating brush to get off any of the excess dead skin cells that might be lying on the surface of the skin. And using the other side to just wipe that away. Okay, so let's go ahead and dry the area. This is just the other ply of that gauze sponge. And I'm just using this to dab away any extra fluid. And then of course, just going to dry internally. Alright, so now that we got that taken care of, I am going to perform one more test and I'm just going to apply some gentle cupping or compression therapy to the area. Now this is going to allow for proper oxygenation and blood flow to the area. So essentially what I'm doing is siphoning this cup, and that is going to provide a suction that will bring blood flow to the surface. So what that means in layman's terms is that your blood is going to come to the surface and it's going to remind your skin to heal itself essentially. So if you have any of that infection that we were discussing, it will be more likely to heal faster. So we're basically encouraging that life cycle, okay? So I'm just going to place this directly over the navel, applying a gentle pressure here. And you're going to feel like kind of slight sucking. It shouldn't be uncomfortable. Okay. Just going to leave that on for just a second. And again, the pink coloration is just the capillary response, and that is completely normal. That is what we're looking for. So I'm just going to do that a couple more times. Good. And one more time for good measure. Alright, so I'm going to give that a rest for just a second, and the last thing I want to do is just re-perform one of the test from earlier. So now that we have it cleaned out and the surface of the skin has been scrubbed essentially and cleaned of any debris, I do just want to re-perform the test of your abdominal reflex. So going back in with a tool that is very cold, so this is our tuning fork. I'm going to just apply this randomly as I did earlier, and we'll see if there's any change in response, okay? Alright, so this is going to be very cold and very good. So seeing a much stronger response this time. Good. Okay, so it does appear as if this treatment was effective. Now, of course, we are still going to send your sample to the lab, and that should give us a better indication of treatment. So as soon as I receive those results, I will be contacting you, and if any prescription is necessary at that point, I will send it over to the pharmacy. I would say you should be feeling some relief. Probably less itchy. Yeah. And that will continue to provide relief as time passes, okay? So I would continue to wash with a mild unscented soap. So you want to make sure that it is unscented because any fragrance at this point will irritate your skin as it is in a more sensitive state. You also want to make sure that you are drying the area very thoroughly, okay? So a towel is usually too large to insert into the navel. So what I would suggest is using either a tissue or a paper towel, maybe even like a thin cotton t-shirt. You can place around your finger and then just insert it gently and kind of swirl around and ensure that you are drying the area properly. You don't want to leave it wet. I also don't recommend that you go swimming until we get your results back, okay? Okay. All right, Isabella, I would say that concludes your examination today. As stated, I should have your lab results within about 24 hours, so I will likely be calling you, if not tomorrow evening, then the following morning, okay? Okay, well, thank you so much. Let me just go ahead and pull your pants back up here, and I will give you a couple minutes to gather your things, and I hope you have a good evening. Thank you.